This is Debbie Bucher with Parkland College, and this is with the LPN to RN Transitions course. And today we will be looking at Chapter 5 in the 4th edition by Laura Claywell, and it's using nursing theory to help guide professional practice. So nursing theory is really our foundation for nursing practice, as it helps to best define best practice and provides new knowledge so that we can have the best outcomes for our patients. It also helps to provide a systematic approach to professional nursing practice that focuses on the patient. Nursing theories have contributed to the expanded knowledge unique to the nursing profession. Nursing theory is an organized framework of concepts and purposes designed to guide the practice of nursing. And the first nursing theories appeared in the late 1800s. And nursing theories were developed are developed to explain and describe nursing care, guide nursing practice, and provide a foundation for clinical decision making. There's many different theories. There's grand theories that are applicable on a broad scale, middle range theories that apply to a smaller subset of situations, and nursing practice theories that guide nursing practice. So you may not think that nursing theory is maybe applicable to you as a nurse, but when in fact it is, and it's actually very important, and it helps to provide a systematic approach to patient care and also helps to serve as a tool for critical thinking and decision making in your nursing practice. So philosophies, they express beliefs about nursing and nursing related values. A philosophy is a school of thought or study that seeks to clarify an approach in nursing, a worldview, and more widely understood. Nursing philosophies are beliefs about nursing and nursing-related values. They serve as a guide for professional practice and influence professional behaviors, as well as giving direction to the nursing profession. Examples of nursing values of caring and listening, empathy, knowledge all help to guide our practice. Nightingale, Watson, and Benner all have nursing philosophies. And Watson believed that caring is the center of nursing care and advanced her 10 curative factors, and that advocates for the importance of nursing self-care, which then reveals itself in human treatment for patients. Pat Benner's model reflects her belief that nursing knowledge accrues over time, and the model comprises 5 skill levels: novice, advanced beginner, competent, proficient, and an expert. So when you guys graduate as an RN, you will be a novice, even though you may practice as an advanced beginner or a competent nurse as an LPN if you've been practicing as an LPN, but you'll go back to being a novice level when you first graduate with your RN degree. Next, concepts. Concepts are the building blocks of nursing theory, which are based upon a personal philosophy or belief about nursing and may be abstract or concrete. They allow the theorist to describe and classify a phenomenon of interest, and a concept can be thought of as an idea, but must be clearly defined to reduce misunderstanding. And the term construct is often used interchangeably with concept, but a construct is generally thought of as being more abstract. Nursing philosophies, models, and theories also have 4 common universal concepts: person, health, environment, and nursing. Next, we'll look at conceptual models or nursing frameworks. Conceptual models are made up of concepts that are phenomena in reality from specific viewpoints that strive to understand in a concrete manner whether this is indirectly or directly observable. And conceptual models are representations depicting phenomena, again, that's occurring in reality, presenting from specific viewpoints and perspectives that strive to help users to understand or grasp the phenomena or system in a concrete manner, and whether directly or indirectly observable. Models can be one-dimensional or multi-dimensional, and often involve input, output, directionality, and boundaries. And the models that's in this chapter were created by Johnson, King, Levine, Newman, Oram, and Rogers. And theories are an integrated set of concepts and statements that can be used to explain, describe, predict, or control a certain phenomenon. May be developed using inductive or deductive reasoning. Using deductive reasoning, it proceeds from the general to the specific, and an example is, all members of the nursing class are under the age of 50. Mary is a member to this class, thus Mary is less than 50. And then inductive reasoning proceeds from the specific to the general. An example is 30 females between the ages of 20 to 35 had symptoms of stress during testing, thus all females under 50 will have symptoms or stress during testing. So I'm going back to middle range nursing theories. I'm not sure that this got recorded. So middle range nursing theories answer specific nursing questions, describe phenomena, explain relationships, and predict the effects of one phenomena or another. They should be clear, simple, generalizable, important, and accessible. And some examples of people who wrote middle range nursing theories are Orlando, Pender, Leininger, Newman, and Parse. Parse's model rates quality of life from each person's own perspective as the goal of the practice of nursing. Parse first published the theory in 1981 as the Man Living Health Theory, and the name was changed to the Human Becoming Theory in 1992. Ida Jean Orlando wrote the nursing process theory. She states that nursing should meet the immediate needs of the patient and relieve distress or discomfort. Assessment should include verbal and nonverbal behaviors. Nola J. Pender wrote the health promotion model. Pender's 10 determinants of health promoting behavior reflects the active role of patients in managing their health. Prior related behavior, personal factors, perceived benefits to an action, perceived self-efficacy activity-related event, interpersonal influences, situational influences, commitment to a plan of action, and intermediate competing demands and preferences. We need to prevent disease and promote health and wellness promotion has become a major focus of nursing education. Madeline Leininger, she wrote the culture care theory of diversity and universality. Cultural competence is an important factor in nursing care. Nurses must investigate the cultural community of their patients and base their care on the patient's beliefs and values. And Margaret A. Newman wrote the theory of health as expanding consciousness. Newman believed that interactions between the patient and the environment were the key to health. A disruption between the two created illness, whereas wellness characterizes the organized state. Other theories are the role theory. Role theory, patients live within a defined role and sometimes within several roles. Understanding these roles can help nurses care for their patients more effectively. This is you all experience a role transition as you become an RN from an LPN, and you may experience role transition and role confusion as you expand your nursing practice. And adaptation theory, patients will adapt or adjust to their circumstances in a variety of ways. And understanding adaptation theory, we need to understand how humans cope or how they do not cope with physical, developmental, emotional, intellectual, social, and spiritual stressors. Nursing philosophies. In Florence Nightingale's philosophy of nursing, she describes the nurse's function as one that puts the patient in the best condition by nature to act on him or her, focuses on the environment, and describes in detail the concepts of light, cleanliness, ventilation, warmth, diet, and noise. There are three major relationships: the environment to the patient, the nurse to the environment, and the nurse to patient. Nightingale believed that nursing duties should focus on the patient, but environment does play a large part in the patient care. And she believed as nurses we can manipulate the environment every day to help improve patient recovery, and believed good education was needed to be a nurse and as a respected person of the healthcare team. Again, an example would be maybe in the environment is maybe reducing the noise on the floors of the hospital to help promote rest and healing, which of course is important. Virginia Henderson, she defined the definition of nursing as assisting the individual, sick or well, in the performance of those activities, contributing to health or its recovery, or if not recovery, to a peaceful death. She is credited with integrating the view of holism into nursing. She identified 14 needs that can be broadly categorized in terms of physical, psychological, emotional, sociological, spiritual, or developmental needs. So these are the fundamental needs are breathing, eating and drinking, eliminating, moving, sleeping and resting, selective clothing and dressing, regulating body temperature, maintaining adequate hygiene, remaining free of harm and avoiding harming others, communicating, maintaining free of, learning and seeking general fulfillment, worshiping, working, and playing. Jean Watson wrote The Philosophy of Science and Caring. It's organized around 10 curative factors that it attempted to honor the human dimensions of nursing's work and the subjective experiences of the people the nurses serve. There's a caring healing paradigm and a commitment to self-care. Watson believed that the 10 curative factors was meant to honor nurses' work and the patient's subjective experiences. Patients can't be treated as objects and can't be separated from nature and the universe as a whole. Everyone has a commitment to self-care. So the 10 curative factors are values, faith and hope, compassion for self and others, trusting, rapport, encouraging and accepting emotional expression, analytical decision-making, collaborative teaching and learning, supportive environment, as well as meeting needs. Patricia Benner wrote the Novice to Expert philosophy. It focuses on clinical nursing practice and her belief that nursing knowledge accrues over time. There's 5 levels of skill acquisition and knowledge. 1 is novice, 2 is advanced beginner, 3 is competent, 4 is proficient, and 5 is expert. The novice nurse is a student nurse or skilled nurse placed in an unfamiliar area, particularly as you graduate with your RN degree. The advanced beginner is considered a new graduate nurse who has marginally acceptable performance and relies on the more experienced nurse. A competent nurse can multitask, plan, set goals, and can think abstractly and analytically. The proficient nurse is able to see the whole picture, recognizes subtle changes, and focuses on long-term goals. The expert nurse has the ability to recognize patterns and responses that are automatic. The nurse reaches this level with much experience. So question a nurse. Okay, so let me go back just a second here. The nurse is using a caring, healing paradigm with 10 curative factors to plan nursing care. Which nurse developed this philosophy? And again, it's to Jean Watson, which I think I already alluded to, but I just wanted to make sure. Next is Hildegard Paplau. She was known as the mother of psychiatric nursing. She wrote The Theory of Interpersonal Relations in 1952. It's grounded in practice and based on the belief that the goal of nursing should be directed towards reducing dependence and encouraging autonomy. The nurse, patient health, and environment are all interconnected and should be viewed within the context of the environment. The interpersonal relationship occurs in interlocking and overlapping phases. There's the pre-orientation phase, orientation, working phase, and then lastly is the termination phase. Example, a nurse working on a psychiatric mental health setting will establish a therapeutic relationship which establishes trust and promotes independence, which is very important. Ida Jean Orlando wrote the nursing process theory. The goals of the nurse are to meet the immediate needs of the patient and relieve distress or discomfort. Nursing practice should be autonomous, and nurses must explore the patient's thoughts, feelings, and perceptions. Assessment includes verbal and nonverbal behaviors, and using the nursing process in the provision of nursing care provides an overall framework for nursing and is effective in achieving a good outcome. So example, a nurse working on the floor should approach the patient in pain by observing both verbal and nonverbal cues. And using the nursing process and the provision of nursing care provides an overall framework for nursing and is effective in achieving a good outcome. The model, is based on the following assumptions. The health promotion model by Pender. And people try to create conditions of living through which they can express their unique human potential. People have the capacity for reflective self-awareness, including assessment of their own competencies. People value positive growth and strive to find a balance between stability and change. People seek to actively regulate their own behavior. People interact with their environment, transforming it and themselves over time. Nurses and other health professionals make up a part of the interpersonal environment, which exerts influences on people throughout their lifespan, and self-initiated reconfiguration of the interactive patterns between people and their environment is necessary for a change in behavior. Margaret A. Newman wrote The Theory of Health as Expanding Consciousness. Newman believed that interactions between the patient and the environment were the key to health. A disruption between the two created illness, whereas wellness characterizes the organized state. Newman's theory makes 6 assumptions. They are: health encompasses conditions described as illness, or in medical terms, pathology. The pattern of the individual patient that eventually manifests itself as pathology is primary and exists prior to structural or functional changes. Removal of the pathology in itself will not change the pattern of the individualized patient. And if becoming ill is the only way an individual patient's pattern can manifest itself, then that is health for that individual patient. Health is an expansion of the consciousness. Nurses need to listen to the rhythm of another person's interactive pattern, which may be irregular and difficult to sense or chaotic. Nurses need to hang in there with clients or patients until a new rhythm emerges. According to Newman, the theory of health as expanding consciousness was stimulated by concern for those for whom health as the absence of disease or disability is not possible. Nurses often relate to such people facing the uncertainty, debilitation, loss, and eventual death associated with chronic illness. The theory has progressed to include the health of all persons, regardless of the presence or absence of disease. The theory asserts that every person in every situation, no matter how disordered and hopeless it may seem, is part of the universal process in expanding consciousness, a process of becoming more of oneself, of finding greater meaning in life, and reaching new dimensions of connectedness with other people and the world. Next is the model by Dorothy E. Johnson. She wrote the Behavioral Systems Model. This focuses on human behavior, and the goals of nursing are to assess the internal and external environments, help the patient select mutual goals, and develop interventions. She believed that persons are composed of 7 interrelated behavioral components or subsystems that all function together to form a whole, such as attachment, dependency, ingestive, eliminative, sexual, aggressive, achievement, and restorative behavior. So an example of Myra Levine's conservation model is the nurse caring for the patient with AIDS will plan interventions aimed at conserving the patient's energy and facilitating rest. And secondly, then the nurse caring for a patient with a leg amputation realizes that the patient must go through changes in order to adapt to the new disability. And again, with Myra Levine, she believed that the health or well-being of a patient is sustained through adaptation, a process of change where conservation is the outcome. Next is the Betty Newman healthcare systems model. She believes a person is a complex system who responds to the stressors originating in both the internal and external environments. It guides nursing practice at 3 levels of prevention: primary, secondary, and tertiary. Nursing should treat the whole person, whereas systems of individuals, group, family, or community are seen as being in constant change or motion, and interventions are aimed at maintaining stability. It's important to look at a patient from a holistic perspective. A patient isn't simply whatever the illness or injury that's being treated, but is in fact an entire person. Again, somebody's mother, brother, father, sister, brother, aunt, uncle. In fact, every aspect of a patient can contribute to how the patient deals with treatment and recovery, and it should all be considered when caring for the patient. In Betty Newman's nursing theory, patients are cared for from a holistic perspective in order to ensure they are cared for as people and not simply ailments or illnesses. In the Newman Systems model, the nurse's role is to keep the system's stability by using 3 levels of prevention. The first of primary prevention, which protects the normal line and strengthens the flexible line of defense. The secondary prevention is used to strengthen the internal lines of resistance, which reduces the reaction and increases resistance factors. And finally, tertiary preventative readapts, stabilizes, and protects the patient's return to wellness after treatment. And in Dorothea Orum's theory, she states that Orum believes that self-care must be learned and performed deliberately and continuously. Appropriate care for the patient is developed through 3 operations to determine a self-care deficit: diagnostic, prescriptive, and regulatory. Diagnostic operations would include establishing a nurse-patient relationship. Prescriptive operations occur when self-care needs and deficits are determined by the nurse and reviewed with the patient, and regulatory options refer to planning of the care. Next, Sister Calista Roy wrote the Roy adaptation model. It's based on adaptation and adaptive behaviors that are produced by altering the environment. Roy believed that the goal of nursing is to promote adaptive responses through a 6-step nursing process. These steps are assessing behaviors, assessing stimuli, formulating a nursing diagnosis, setting goals to promote adaptation, implementing interventions, and evaluating whether the goals have been met or not. Roy developed her theory based on the social and behavior sciences and systems theory. After the nurse has assessed adaptation and adaptive behaviors, he or she can then develop nursing diagnoses to help guide goal setting and interventions aimed at promoting adaptation. Roy viewed the person as a psychosocial adaptive system with physiological, self-concept, role function, and interdependent modes. Application to practice. The nurse caring for the new mother and newborn will plan interventions to facilitate bonding, promote adaptation to the situation and environment, and decrease harmful stimuli. The nurse caring for the individual following a natural disaster uses the 6-step nursing process to plan interventions to decrease the environmental stimuli and promote adaptation. Question. A nurse wants to use Imogen King's model to plan nursing care. Which principle should the nurse remember? And it is 3. Human beings are the focus of nursing care, and the goal is health for individuals, families, communities, and of the world. Your personal nursing theory and philosophy, it will be up to you to choose the nursing theory that most lines up with your beliefs and appropriate to your practice. It provides the rationales for why you do what you do and serves to guide nursing practice, and it helps to develop a personal philosophy of nursing. Will require examination of your personal beliefs and professional practice, and will reveal your growth as a nurse. Now, nursing theories are somewhat, I think, sometimes a little bit harder to understand. So listening and going back and making sure you're reading your book to make sure you have a good understanding of the difference of these theories would be helpful. This now ends the lecture for Chapter 5 in the LPN to RN Transitions course. Thank you.